Bismillah ar-Rahman ar-Rahim, my dear vascular colleague, another lecture in the Mastering Vascular Surgery series, number 12, what I have learned from LINC 2024. I think it's very essential for vascular surgeon to follow up the recent vascular congresses like LINC, Charing Cross and Frank Vieth. And even if you're unable to attend, you should know what is new that they have offered. In the last meeting, LINC2024, which was finished yesterday, there was a lot of talk about vessel preparation. And one of the very nice lecture came with this, I think is a great slide, which vessel preparation you need to do before DCB. And he divided into three types. The first type is conventional pre-dilatation with a standard balloon. This is what we usually do for vessel preparation. Either you do a single balloon pre-dilatation and gradually you enlarge the pre-dilatation. So if you are in SFA, you start by, let us say, 4-5 millimeter, then maybe 6 millimeter if you want to put spare stent. And this is one of the easy ways for conventional vessel preparation. Now, there are now balloon-based vessel preparation devices. So these devices can be scoring balloon, chocolate balloon, which this image is a chocolate balloon. And the chocolate balloon, as you have seen the names, have a wire on top of it that will fracture the atheroma. A chocolate balloon pre-dilatation is now becoming quite common practice to use with obviously added cost. Cutting balloon, which is little bit risk about perforation, but the only cutting balloon is available by Boston Scientific. And also lithotripsy. Lithotripsy, especially if you have a calcification in the plaque. Lithotripsy balloon. All these four devices are called balloon-based vessel preparation devices. Now, lastly, the obvious tool by Thomas Zeller is atherectomy devices, which can be divided into three: directional atherectomy, excimer laser atherectomy devices, and rotational atherectomy devices. Laser is getting out of fashion. If you remember in the old days, 10 years ago, when laser atherectomy started by Guardio Biamino, it was common. Usually we see about 10 cases every LINC. But nowadays, laser is becoming back. Very less often that you see laser atherectomy devices, but still it's a good option in United States with FDA approval. But now we have a lot of directional atherectomy devices and rotational atherectomy devices. So which one is the best? This what will going to come with the head-to-head study. They are actually concentrating, is a chocolate balloon better or atherectomy devices? Which one is better? Obviously, in calcification, lithotripsy seemed to be unique advantage. There was very nice lecture in vessel preparation selection, either to debulk or use a chocolate balloon. And this was very nice lecture presented from China by Cheng Wang. And he is from the Capital Medical University in Beijing, one of the very big hospitals in China. I will summarize to you his, I think, about 15 minutes lecture. This is the conclusion slide, which is extremely important. He presented multiple cases when he had used a chocolate and used debulking. And he found that from his experience, this is not head-to-head study, but from his experience, directional atherectomy devices like hook device is of benefit in heavy calcified fempop lesion, in long occlusion, and in common femoral artery lesion, especially when you get the SFA and the profunda. But you have to be very experienced in atherectomy devices. These three are indication for atherectomy. What about a chocolate balloon? If it is a stenotic occlusion, not an stenotic lesion, not an occlusion, just a stenosis. If it is short, if it is popliteal or PTK, then he preferred chocolate. And if patient who cannot tolerate longer procedure. So atherectomy is a longer procedure because you need to take all the four quadrant of the blood vessels. But a chocolate balloon, just one inflation, and you get a good vessel preparation. So this is quick if patient will not withstand long occlusion. I will try to summarize over, let us say, 5 to 10 minutes what I have learned from each of these congresses, and I hope it will be of benefit to you in your practice and in your exam. And I wish you all the best. Dr. Muhammad Omar Farouk, consultant vascular surgeon.